right, welcome back to the Fair and Focus podcast, where we take female, women, and girl athlete injury prevention consensus papers, otherwise known as the Fair Consensus Papers, and we try and make them useful and practical and some utility for athletes, coaches, clinicians, researchers, parents, you name it. So today we're talking about prevention strategies and modifiable risk factors for concussion for female, women, and girl athletes. And I got the pleasure of sitting here with Dr. Isla Shill. She's the lead author of the Fair Consensus Concussion paper. So by way of background, Isla is a postdoctoral research fellow at the University of Victoria in Victoria, British Columbia, in the School of Medical Sciences, Faculty of Health, and the Institute on Aging and Lifelong Health. That's quite a long title. Isla's research focuses on the prevention of concussion in youth, female girls rugby. So, Isla, welcome.
Thank you so much for having me, Mark.
Yeah, very, very glad you can be here. So let's just talk about the kind of the broader specter of female, women, and girls sport around the world, and just how rapidly that's expanding, just not from the amateur level, but right up to the professional level. Um, there's just been a tremendous rise in participation, right? Is it fair to assume then that the number of sport-related injuries and concussions for female, women, and girl athletes is also correspondingly increasing?
I don't know if we know that they're necessarily increasing per se. I
Okay,
think given the professionalization of women's sport and call it what, the last decade or so,
sure.
there's been so many more resources, a lot more money, a lot more research into the space.
Hmm.
So I think we're doing an exceptionally better job at tracking and understanding what's going on in this population. I think we have a better idea of what the burden of injury and concussion is in some contexts, although we still have a long way to go. So I wouldn't necessarily say that we see increasing rates. In some
Hmm.
cases, in some situations, that could be the case, but I think we're doing a way better job of understanding what the true injury or concussion problem is, if that makes
Right.
more sense.
It does. And I would, just thinking again about that spectrum of like amateur sport up to professional sport, I'm sure in the professional leagues, these teams have got resources and personnel that they can dedicate to injury prevention and tracking, but obviously less so at the amateur level, right?
Mhm.
Yeah,
Absolutely. Yeah.
yeah. So, based on my last conversation in the last podcast with Emily Hemming about upper extremity issues, we were talking about kind of that disparity in research quantity and quality of research data on female, women, and girl athletes. And we know that a lot of the interventions that were developed, certainly in the concussion world, were really based on data from male and boy athletes, right? Can we map the same approaches that we might use for a male or boy athlete onto the female, women, and girl athlete universe?
I think we need to be cautious. We need to be
Mm,
careful. I think we need to do our due diligence just because a training program, policy change, piece of equipment might work for male, man, or boy athletes.
right.
I wouldn't say we can assume that it's directly transferable into female, women, and girl.
Hmm.
There's a lot of different sex and gender related factors
Right.
that need to be considered to make sure that a certain prevention strategy is still applicable in a female, woman, and or girl context.
Right. And I think, one of the ideas is that idea of just this all sports, not just rugby, which you're familiar with, but all sports. The training methodologies that everybody's using these days, from amateur sport up into the professionals, it's just so sophisticated now, and there's nutritionists, and I know from, because we're in Canada, at a junior hockey level, so many resources are being thrown into amateur sport, for kids these days. And athletes are getting stronger and fitter than they've ever been before at younger and younger ages. Is that at the same time a preventative factor in so much as it is also a risk factor when we talk about just people being stronger and fitter?
I think so. Putting my, I guess, rugby hat on. So
Mm,
I have done a lot of research in the girls' rugby space. I have a playing history in rugby. I've coached rugby as well. Um, I think especially when you're dealing with a youth or adolescent or kid population, there's
mm,
definitely some parallels when you're thinking of physical literacy, appropriate body movement, training. Obviously, you want to have some foundational conditioning.
Right.
to decrease potential risk of injury later on. And it makes you more what we'll call physically robust to better withstand the demands that a certain game, training, session, drill is asking of you.
Right.
So I definitely think there is a link there. And that's kind of where we see different training programs come to be historically.
Okay.
Um, yeah.
Okay. Okay. Let's get into some of the data from the paper itself. So one of the figures that kind of jumped out at me was that 37% of the studies that were reviewed were female specific uh, data, right? And this is again, I think this is kind of consistent throughout a lot of the papers of the fair consensus.
Yeah.
What does that gap mean specifically for and practically for coaches and clinicians who are trying to make decisions right now based on kind of that dearth of data, really?
I think um, I think it's challenging.
Mm,
Obviously, there's a lot of good research out there. We have evidence in male man and the male man and boy space, I should
yeah,
say.
yeah.
But I think it's challenging because we know that in a female, woman, girl sporting context, there's a lot of
Mm,
different factors that need to be considered. We can't just directly translate it through. So it's important that ultimately we can generate evidence for female, women, and girl athletes to make sure that we can inform the most appropriate training programs, policies, recommendations, all those pieces
mhm.
to have ultimately inform player safety and welfare.
Right. Okay. And speaking of welfare, one of the pieces that the paper talks about was that idea of using personal protective equipment or PPE. And I know the paper references specifically headgear and eyewear. And I think at the end it kind of says, there's not a tremendous amount of certainty around that data necessarily. Um, and yet again, from a parent or just the public's perception of using PPE in sport, for armchair kind of athletes on the weekends who are watching things like the NFL and they see professional players running around the field. What do they call them? Gridiron caps? What do we call those? The
Guardian caps.
Guardian caps. Thank you. Yeah. So we see those players with Guardian caps and we say like, oh, okay, well, professional athletes are using some protective equipment. Should I consider investing in protective equipment to shield my youth athlete from something like a concussion? What would you say?
Yeah.
Well, is that something people should really consider right now or no?
I think you should always, like any prevention strategy, I think you should always consider something, even
Sure.
equipment.
Okay.
Thinking specifically to the paper, so the two results you're referring to were just meta-analyses we were able
Hmm.
to do. So meta-analyses are basically when you have results across two or more studies that are as similar as possible. So you can actually pool the results together to get we'll call it an overall effect.
Okay.
Um, so with the headgear and the eyewear papers, it was only two or three papers off the top of my head that we looked into. And I think
Okay.
it should be interpreted with caution. There's still
Hmm.
not a lot of research in it. I think eyewear and headgear, when we talk about headgear, we talk about hard shelled and soft shelled headgear. So
Hmm.
soft shelled being something like a scrum cap you
A
might see in
scrum cap.
rugby.
Right. Right.
Yeah. But they were also originally developed for other to prevent against other injuries, not necessarily just concussion. So eyewear,
Hmm.
you would typically think about you're avoiding any sort of eye injury. Um, Headgear was or scrum caps, so soft-shelled headgear was traditionally developed to help any sort of head lacerations, cauliflower ear, any of those pieces.
I see. Okay.
Um, any sort of blunt trauma to the head, to deal with any of those superficial injuries. So I think you have to be mindful about what the equipment piece is. It's not to say that it doesn't have a place in just general injury prevention. But
Hmm.
when we're talking about concussion specifically, it might not be the most optimal strategy that we know of yet because there's still so little evidence there.
Okay. And then so in terms of strategies, let's shift to training, like how we train our athletes.
Yeah.
And knowing that you've been involved in rugby a lot, talk to me a little about some of these rule changes specifically in the female, women, and girl space on tackle heights and things like that. Is that a something that's a positive direction that is showing some fruit?
Yeah, it's gaining traction.
Okay.
So I think the big thing with the rugby space and the lower legal tackle height is just over the past couple of years, World Rugby, so the large international governing body for World Rugby or the global governing body for rugby, made a global recommendation that
Mm,
the community rugby game should see a lower tackle height. And the reasoning behind that is theoretically, if you're telling the tackler, the person that's engaging in the movement, they can't tackle above a certain line. They're trying to avoid situations where heads are occupying the same space. Because
I
in
see.
previous
Okay.
research that was done mainly in professional men's rugby,
Right.
was found that when head to head contact was the highest risk of concussion.
Okay.
So that's kind of why they've been playing with the spacing for tackle height.
Right.
Um, and now we've since applied it to a broader community context. But we're still since the consensus and the recommendations and systematic review has been published, we've seen more work come out about tackle height in women's sport, but it's or women's rugby, but it's still gaining traction.
I see. Okay. Similarly, let's shift again, slightly staying in the training space to neuromuscular training. And I know that in the past there's been some research done on the use of neuromuscular training in the boys rugby in the UK, and it showed some good results, right? Same principle there. Is still more validation and research needs to be done in the female game before we can assume that that's also an appropriate strategy?
Yeah, great. So again, it's funny because the original review was done. We ran the search strategies for the original review in the fall of 2023, maybe.
Okay.
So even in the past 3 years, there's been a huge flourish of female women and girl research that's come out. So since then, there has been an evaluation for girls neuromuscular training warm-ups in a girls rugby setting. So that was part of some of
Hmm.
my PhD work.
Hmm.
So originally the recommendation was based on the data that came out of the boys' men's evaluation. And generally speaking, there is a lot of evidence in the broader injury space, sport injury space beyond concussion that they do reduce different injuries. Um, but it's now transitioning into the concussion space. And there is some early evidence to suggest that it could be a promising protective effect against concussion, even in girls.
Right. Okay. Um, when we think, first of all, for those listeners who are not researchers or scientists, we talk about modifiable risk factors a lot.
Mhm.
What is that exactly?
It's a great question. So a modifiable risk factor is something, so it's a characteristic, it could be a component, it could be an item, for example.
Hmm.
Um,
Like a mouth guard.
I would be cautious about equipment versus like a prevention strategy versus a modifiable risk factor, but something
Okay.
that will ultimately change. We can target it. So typically our prevention strategies are used to target these modifiable risk factors. So for example, if we establish that, oh, I don't know, some sort of strength deficiency resulted in a higher increase in injury or that kind of thing, we might develop a training program like a neuromuscular training warm-up to target or strengthen that area more and make it less susceptible to injury later on. Does that make sense?
It does make sense. Yeah. And so getting back to specifics to the review identified 34 potential modifiable risk factors, across categories like neck strength, for example, what you mentioned, techniques, lifestyle, etc. But still, work is to be done, right? In terms of those modifiable risk factors, where do you see, if you can narrow it down, what areas do you see the most promise in?
That's a great question. And
Hmm. That's why I ask. I have great questions.
I don't know if I have a golden bullet, this
Hmm.
is the answer. I don't know that I have it because especially in the female woman girl space, there's so much we are still uncovering. And
Right.
we can think of like female specific factors when we think of sex related factors, we can think of gender related factors, we can think of the environment. There's so many rocks we haven't like turned over yet, if that
Hmm.
makes sense, that
Sure.
I don't think there's still so much work to be done.
Right.
If I'm gonna give my biased opinion. I think a very neat space to be in right now is something like tackle technique in rugby. So changing different components of how someone's tackling to make it either to make it less injurious or less concussive or improve performance. I think the tackle technique space is a really cool place to be in right now.
Right.
But that's again my biased
Right.
insight on my
Right.
background. But
Right. Okay. Well, that was really my last question was just, of those rocks, what are you most excited about? And so it sounds like it's the training and the tackle training piece for you. Yeah.
yeah, I would say that's accurate.
Okay. Well, wonderful. Okay. Well, Isla, thank you for doing this today, first of all. Thanks for condensing down what was an enormous amount of work into about a 12-minute conversation. I appreciate you doing that. That's very useful. If you want to learn more about Fair Consensus, you want to download any of the papers or just look at more of the resources, great resources there, go to the website. It's Fair Consensus, all one word, FAIR consensus.com. It's a slick site. It looks great. Podcasts will be up there. Lots of resources going to be up there. So I definitely recommend checking that out. Tune in, excuse me, to our next episode where we're going to focus again on another one of the Fair Consensus papers. And we'll talk all things related to injury prevention for female women girl athletes. Isla, thank you again for joining today. And I look forward to seeing you soon.
Yeah, thank you so much, Mark.